If you have PMS or premenstrual syndrome, don't you just hate it when somebody asks you, is it that time of the month? Especially if it is that time of the month and you're experiencing a lot of hormonal changes that are causing a lot of discomfort and disruption in your life. Let's say that you're super angry and irritable, but you have these intense cravings for salty and sweet food. Maybe you're really sad and you're finding that you're crying all the time or that it's difficult to go to work. PMS is not an excuse. About 90% of women have some symptoms, whether it's a little bit of cramping or something that's much more disruptive. Only about 20 to 40% of women have symptoms that are so severe that it interferes with their daily life. But many people find that their relationships change and that their friends and family members are wondering what they can do to help. PMS is definitely a biologic condition that impacts some women more than others. And it's not you. It's not because you're not coping well. It's biology. You see, every month when we have our menstrual cycle, we have a hormonal roller coaster. We have estrogen and progesterone that are released in different amounts throughout the cycle. Well, those two hormones can impact our moods. Estrogen, as we know, is a precursor or a building block hormone for serotonin. And serotonin is that feel-good neurotransmitter that we all have in our brains. And so when we have a change in our hormone levels, when we have that hormonal roller coaster, a lot of women notice some changes in their moods and in their symptoms. Some of the symptoms are physical, like bloating and constipation and a lot of cramping, and some are emotional, and some are a combination. If you are having PMS, the first thing I want you to do is to track your symptoms. Keep track for at least 3 months. That will help you and your healthcare provider decide on what treatment options might be best for you. And don't worry, some of those options are lifestyle changes like exercise or supplements, which I'll talk about more in a minute. When women have PMS, what they need is to know that they're normal and there's a lot of things they can do. So after you start tracking your symptoms, ask yourself about your exercise. If you're getting regular exercise, that is every single day, not just during the 3 or 4 days before your period or during your cycle, but every single day, that will help increase your endurance. It'll help you feel healthier and help reduce the risk of a lot of other medical conditions. But it also does something very important. Exercise helps your body release endorphins, and endorphins are other really good, helpful, feel-good neurotransmitters that help with our moods. So try to exercise every single day. And if you can't do it every day, then aim for 5 times a week, at least 30 minutes. And this has been shown in research to really help reduce those PMS symptoms. The next thing to do is to think about taking a calcium, magnesium, and B6 supplement. Even if you're getting plenty of calcium from milk or dairy products, taking a calcium supplement with magnesium and B6 has been shown in numerous studies over many years to help reduce PMS symptoms. We also know that some women do really well by using a natural herb to raise their serotonin levels, and that's St. John's wort. Now, if you're already taking a medication that raises your serotonin levels, that's something to talk to your healthcare provider or your pharmacist about. But St. John's wort, taken in small amounts, can really help reduce those symptoms. Some women also find that by taking a supplement called Serenel, which also raises your serotonin levels, and that's available through Bonafide, that can also help with PMS symptoms. So what about those of us who don't do well with those natural lifestyle changes, or it only helps a little bit and they're looking for something else? Well, in that case, if you track your symptoms for at least 3 months, you can talk to your healthcare provider about different therapeutic options. For instance, antidepressants like SSRIs, those are selective serotonin reuptake inhibitors, things like Prozac, Zoloft, Effexor, and Lexapro. All of those have been shown to help reduce PMS symptoms because they raise serotonin levels. The good news is that you don't have to take those every single day of the month to see a benefit for PMS. Many women find that by taking those medications for just 7 or 10 days prior to their anticipated period, they have a lot fewer of their PMS types of symptoms. Some women also find, and this is something that I've been prescribing for years, and that is continuous birth control pills. So if you think about treating PMS and going to the root cause is hormonal roller coaster, right? So instead of having all those fluctuating hormone levels, by using a combined birth control pill or the vaginal ring, anything that has both estrogen and progesterone in it, that can help even out those hormone levels so they're nice and smooth day after day after day. The key though, and this is the key, is to take the birth control pill or use the ring every single day, not to stop, not to have a period. So there's no change in the hormone levels as we either stop the pill or remove the ring. The hormone levels aren't dropping, and that's not affecting those hormonal levels, and it's not affecting moods. So I've had many patients be on what we call continuous hormones, continuous birth control, or continuous vaginal ring. They don't get a period, and that's perfectly safe, perfectly okay for your body, but they don't get those hormonal fluctuations, and that helps alleviate a lot of those PMS symptoms. One size never fits all. That's why it's important to track your symptoms and talk to your healthcare provider about what's the best option for you. Now, if you like this video, please click like and subscribe. Leave me a comment below and let me know the other topics you want me to cover. Take care and be well.